I've talked to you before about healthcare a
Mm-hmm.
few times, and I have really good health care, I'm glad to have.
Mm-hmm.
But you said to me on air one time, if you had your way, you would revamp the healthcare system and make it free for everyone, even if it would diminish the quality of healthcare for many Americans. It would elevate others.
Okay, let
Right?
me
And
ask you a question. Let me ask you a question. Can I ask you a question, sir? Because since we're talking healthcare, and I think it's so important for you to call in, by the way, Joseph, thank you again. My question to you is, whenever you hear the word that, I did a show on healthcare about three shows ago where I played a piece from the right-wing guy that said, the reason we can't give healthcare to everybody is because there are not enough doctors, et cetera, et cetera, et cetera. And my heart sank. How did you feel to hear that? And how do you really feel if what you're saying is true, right? That I and people like myself want to give healthcare at the expense of the quality of healthcare in the aggregate, right? That's what you're thinking. I'm trying to tell what I have to convince you about, right? Is that what I want to do isn't diminish your healthcare, but to ensure that everybody has healthcare and that we don't have to diminish healthcare to accomplish that. And what you're saying, you're going from the perspective that says if you give other people healthcare, and no healthcare is free at all. I'm not talking about getting healthcare free at all. I'm talking about if you want healthcare, it happens similarly to what happens in other industrialized nations. You have a card. And, I did an interview, I don't know if you listened to it, with this guy who has Canadian healthcare, right? And he said the last thing on a person who's sick mind in Canada is healthcare. Rather, it's money. When my blood pressure got up to 220 over 140 at KPFT, doing a show there at KPFT, and they called the ambulance for me, etc. The first thing on my mind is how much was that ambulance going to cost me? And in as much as I had insurance, and afterwards I jumped out of that ambulance when they told me what the cost would be, given the 10,000 deductible that I had, and went home. That is inhumane. That I put myself at risk, my family at risk, because I knew that there's a good likelihood I could make it to the hospital on my own. And what I'm asking you is the following. If I can prove to you that everyone, like in any other country, can have better health care than we have right now, because that's a fact. If I find a way to get into your mind, wouldn't you want that as well, sir?
So I disagree.
Again, my question. Again, this is a yes or no question, my brother. In other words, if I can prove to you over time, that we can have great health care for everybody, given the current amount of money that we spend in health care, if I can convince you of that, would you then say, I want all my brothers and sisters to have health care?
I agree that yes, we can come to an agreement.
So sir, you agree? I mean, my thing is this.
Wait. It's not going to be me agreeing to your position, right? Because
it's not my position, sir. It's not my position. It's not my position at all.
You said you're going to convince me of something, right? So,
what I'm convincing you. No, I'm not. I'm not convincing you of my position. I'm convincing you that we have enough money to cover everybody's health care. The reason I'm convincing you of that is I'm saying there are others who've convinced you already that there isn't money and that somehow the quality of care would be reduced. That's what you told me. And what I'm saying is that is a categorically false statement that you believe, but I have to do the work to show you that what the other people that you have trust in that have told you that, I have to prove to you that they are wrong. And I'm saying if I can do that, because I'm appealing to your humanity. So if I can show that, which is my job to do, would you then say, yes, I want healthcare for everybody?
Of course.
And I know that's what I said. I'm appealing to your humanity.